they will look at the length of the leg. When it's common, it doesn't mean that it always happens, but it's common. People that have, especially if the fracture is of the neck, or if they have a fractured neck, typically the leg will look shorter. Okay, so look at the patient, and if you see one leg shorter than the other, probably, unless it has something else going on, probably is fracture. If they are complaining of the hip, if they say it hurts, they cannot move the leg, and you have one leg shorter, most likely. If it quacks, it's probably a quack, right? So, so probably, if that's what it is, if you see one leg shorter than the other, probably it's fracture. So you don't want to move the patient. So this is the time when we're going to use this projection. Okay, and the idea is that we're going to bring this leg up, hands up, so we can see. The idea is to bring the leg up and take a picture. We're going to come, our angle, the X-ray beam, is going to come through, and it's going to go through the neck of the affected side. Okay? So let's, where's our folder? So something like this is ideal. You don't want to use, as I said in class, you don't want to use an X-ray tube. And we're going to bring it up a little more. We need, because you have more soft tissue here. Okay? Someone with big legs, then is difficult. So you want to bring it up. So in this case, we'll bring it up a little more.
You don't be gentle with patient.
Okay. Yeah. Okay. So something like that. Make sense?
Yes.
Okay, good. All right. Now, we will also, when you're doing this projection, you need a grid. This cannot be done just with a plane. You're going through too much soft tissue. So let's where are my memory
You don't need to ask, just grab off.
Okay, you can grab it all.
Yeah, everything. share with me. Yeah.
All right. For you guys, we will assume, I don't know what happened to our grid caps. We will assume this is a grid, okay? So, and it is a grid, but it's not used for CRs. It is a grid, so we don't need that. This type of grid already has a cassette, already has an image intensifier added to it, so we don't need to put anything there. There is an image intensifier and a film. So we're gonna put this here. This has to be perpendicular with the beam. So, okay, here's the hip. Here's the let's see. Let's imagine this is the iliac crest, so the ASAS will be here. Symphysis pubis will be here. Bing, bing, bing. So the neck is here. So my central ray has to come through here. Okay? So, and it's going to be perpendicular. Okay? So, if you can give me a cassette holder. Yeah, either one of the two.
I can hold it for you.
No. I want you to watch. Thank you. We'll use that. Yeah, thank you. Thanks.
Actually, in the practical exam, we can ask the patient to hold it for us. Can we?
It's a trauma patient.
The hand. We use his hand to hold it.
The hand not trauma. We can? Can we?
No. No, let's use, I want you guys to use it like this. So, this is our central ray again. So, we're here. And this thing is wobbly.
Want a sandbag?
No, can I have that little sponge there? Or a 15-degree sponge? No, it's good. Thank you. This one's good. Thanks. Okay. All right. So we're going to either, I can think about it. I'm gonna stretch the arm here, so I can park the machine here and bring the tube here, or I can park the machine and put the tube here. So I have more space there. So I'm gonna park it there. Okay. So I'm gonna move this thing a little bit. That's it. Good. So I'm thinking, what I'm doing right now is I'm trying to think how I can get the arm of the portable without me moving that arm too much. Because every time I move it, I create another problem there. With me matching the this portable only swings one way. Alright, as you can see, I could move the arm this way. So that will be the easiest thing to do. Okay. All right, do we have 40 inches? We'll probably have about 44, and that's the best we can do. And make sure that the beam is horizontal. It's 47. That's the closest we can get. So we're gonna take that. So let's take a look here. Things to pay attention to. Make sure that both the central ray and the beam are perpendicular, which they look to be pretty close. Okay, my central ray has to go through the neck. And I had already checked that, and I had already placed my image receptor to the neck. So I'm hitting right the neck, so I can see the head will be displayed up on top. Neck. Okay, and in this way, I'm not moving the leg at all. Okay. Also, I know we haven't talked about this. We're going to talk about technical factors next semester. But this is one projection where you're going to you have to use high KVP. Okay, because of the part you're penetrating a lot. Not only how thick it is, but the angle that you have is a pretty deep area that you're going through. Make sense? And so you have to use high KVP. Because of the high KVP, you're going to be seeing more scatter radiation in the plate. And so collimate as much as possible. So in this case, as you can see, I'm not collimating. I'm not seeing. A lot of times technologists will have light outside of out of the skin. It's not necessary. Okay? You can collimate about that much. Okay?
How would you shield?
Can shield in this case.
Okay.
I mean, you can shield the breast, you can shield the thyroid, but gonads,
Yeah.
you can't.
Okay.
And another thing, I mean, I see a lot of technologists not paying attention to this, but it is important. I mean, it doesn't matter how old the patient is, doesn't matter how conscious the patient is or how unconscious the patient is. Protect the patient privacy. I mean,
Yeah.
you're going to really be exposing a lot like this, okay? And so protect the patient privacy. This is a projection where you want to have the door of your room closed and the curtain closed, and the patient, you need to provide a towel, a pillowcase, something over the patient. A lot of times, by the time the patient arrives to you after a trauma, their underwear is already gone. They had already removed their underwear. And so, once again, they're going to be really exposed. And it doesn't matter how old you are. You know, and I'm just thinking, my grandmother, my mom, tell you,
Myself.
they will, they,
Really?
they will not do this unless they're covered. Okay, it doesn't matter how much pain they are, and they're not gonna do it.
Would
Or my
the-
dad, for that matter.
Like if we put like a pillowcase, a towel, or would it be
A
shown
pillowcase,
on the?
a pillowcase is fine. No, that's what I just said. A pillowcase, you stretch the gown, okay?
An
Yeah.
extra gown.
An extra gown, something, a sheet, something, but
Yeah.
you're not exposing the
But it
patient.
would not be shown in the X-ray. It doesn't matter.
If it is fractured, you're gonna see the fracture. That's what you're looking for.
Oh, okay.
Are you gonna see? Do you ever see a little bit of
Yeah.
the gown when you do a chest X-ray?
Yes.
Yeah, well, that's same thing. Yeah, same thing.
Where do you shoot? I mean, like, where is your goal to shoot? Like,
Through the neck.
the neck is like right here,
Well, that's what how do we find the neck?
the same way as the other one?
It's the same way as you did with the AP, which is what way? Tell me.
The pubic symphysis,
Mhm.
the ASIS,
Mhm.
and the iliac crest, and
No,
you,
not
you
the
create
iliac crest.
a triangle.
Not the iliac crest. ASIS.
ASIS, pubic
Symphysis.